Hello, today we will be demonstrating how to use an AED machine. I'm Isaura and this is going to be my patient, Hallie. An AED is an automated external defibrillator machine that is portable and can be taken anywhere with you, even in a car. An AED works for someone who has or is experiencing a sudden cardiac arrest. An AED helps by restoring an organized heartbeat for the patient. For instance, if the patient is having ventricular fibrillation, which are disorganized heartbeats, the AED will help restore those heartbeats in an organized manner. So the first thing we want to do is assess the scene. Is it safe for me to approach the patient? Is it raining? Do we need to move the patient to a dry area? Are there puddles nearby? Do I need to move or transfer the patient to a dry area? Also, is it safe for me in terms of fire or any other safety concerns that I need to worry about for the patient and myself? Once I have assessed that it is safe for me to approach the patient, I'm going to do so. The first thing I want to do is check the patient. I'm going to assess ABCs, which are airway, breathing, and circulation. If they are breathing, but it's somewhat irregular, and if their circulation is not good, for instance, if their pulse is absent and or is irregular, I'm going to proceed with CPR and or grab an AED as soon as possible. Now this is where I need to ask myself, did I witness this person have a sudden cardiac arrest or did I not witness the person? If I did not see the person have a sudden cardiac arrest, I'm going to start with CPR. I'm going to ask somebody to call 911 and bring an AED with me. If I saw the person go down with sudden cardiac arrest, I'm going to want to use an AED as soon as possible. So we're going to say that I did not witness Hallie have a sudden cardiac arrest. I'm going to proceed with CPR. I'm going to do 5 cycles of it, which is approximately 2 minutes. As soon as I've done 2 minutes of CPR and the AED has been brought to me, I'm going to stop CPR and start using the AED. An AED, so it's a machine just like this one, and it's equipped with tabs called electrodes, and also comes with a bag that includes mask, gloves, shears, a razor, a dry towel, hand towelettes, and cleaning towelettes for the equipment, and a biohazard bag. So, Hallie, I'm going to have you lay down so we can demonstrate how to use an AED. What we have to do is expose the chest, whether it's a female or a male. If it's a female and they are wearing an underwire bra that is metal, I'm going to have to undo the bra so that it does not disrupt with the signals that are going to be sent to the machine. If the patient is male and there's a lot of hair involved, thankfully most AEDs are equipped with a razor and a towelette to clean off the excess hair. Excess hair can also affect the signal that is going to be sent to the machine in order for it to analyze the heart rhythm. Also, does the patient have any piercings? Does the patient have any implanted device or a pacemaker? What I need to be aware is where that implant or device or piercing is located and apply the pads at least 1 inch away. So for the pads, they usually come in a bag like this. We would take them out, and first pad would go above on the right-hand side, sort of on top of the patient's heart. The second pad would go on the left side to the left of the person's ribcage. There is a wire that runs out of the pad, and we would connect that wire to the machine. Now, we want to make sure that we are not touching the patient and no one else is touching the patient. I'm going to turn on the machine and it'll give me voice prompts saying it's going to first analyze the heart rhythm. Once the AED has analyzed the heart rhythm, it'll tell me if a shock needs to be delivered. So if a shock needs to be delivered, I'm going to tell everybody, stand clear, nobody touch the patient. We don't want any disturbances with the signal and or the shock. That can hurt the other people around as well. So I'm going to press the shock button. The machine is going to say delivering shock, and it's going to deliver the shock. Now, what I'm going to do next is I'm going to proceed with CPR. But before I proceed with CPR, I want to check the person's pulse, ABCs, airway, breathing, and circulation. So I would check the patient's breathing. Are they breathing in the manner that I want them to do so? Do I need to adjust their head to assess the breathing correctly? I want to be able to see their chest rise, and I want to analyze their pulse either at the carotid or the radial pulse, whichever is accessible and safe for me to do so. If they still have an irregular pulse, I would start with CPR with chest compression. I would do about 2 minutes of it, and again, analyze the heart rhythm. I'm not going to touch the patient. I'm going to tell everybody to stand clear. I'm going to press the analyze button, and it's going to analyze the heart rhythm again. If a shock is recommended again, I would press the shock button, and then the shock will be delivered. And once the shock has been delivered, it'll stop, and I'm going to again proceed with ABCs. This process is going to continue until the machine tells me, the voice prompt tells me, that no shock needs to be delivered anymore. Once I have assumed that the patient has a pulse again and is breathing appropriately, I'm going to stay with the patient until emergency medical services arrive. Now, I will also stop and take off the pads if the patient starts moving and or is responsive. I'm going to continue this and try to keep them calm and let them know what has been done and wait until EMS services arrive. Once the paramedics or emergency medical services arrive, I'm going to let them know what has happened and what I have performed so that they can take control and transport them to a hospital if needed.